Today, I'm going to dive into one of the most common questions that we get. What's the difference between a Medicare Supplement Plan G and Plan N? Hi, everyone. I'm Holly Cohen, licensed independent broker and owner of my nationwide agency for over 15 years. We specialize in Medicare. And today I'm bringing you the Medicare truth. Today I'm going to break down the real differences between Plan G versus Plan N, clear up all that confusion, and make sure that you know the facts. So here's a quick refresher on Medicare supplement plans, also known as Medigap plans. Let's set the stage. Original Medicare consists of Part A and Part B, which covers about 80% of your hospital and doctor bills. That sounds good, but the other 20% is unlimited and your responsibility. So that's where Medicare Supplement or Medigap plan comes in. These fill in those gaps. A Plan G and a Plan N are the two most popular Medigap plans because they give you the best balance of coverage and value. So, what does Plan G cover? Plan G is the most comprehensive plan available if you're new to Medicare. It covers everything that Medicare doesn't, except one thing, the Part B deductible. In 2025, that deductible is $257. Once you pay that, everything else Medicare approves is covered 100%. No copays, no coinsurance, no excess charges. Plan G is the peace of mind plan. So, what does Plan N cover? Plan N is similar. You still pay the Part B deductible. After that, doctors can charge up to a $20 copay. Hospitals can also charge a $50 ER fee. But if you're admitted, then there is no fee and you are covered 100% by Medicare. Plan N also does not cover the Part B excess charges. So what is a Part B excess charge? It's when a provider wants to charge you more than what Medicare is paying them for the service. So a Part B excess charge means that that provider is allowed to charge up to 15% difference between what Medicare is paying them versus what they would bill you. So now let's talk about that $20 copay. This is where there's a lot of confusion. The $20 copay only applies to Medicare coded office visits, evaluation, and management visits. This means regular checkups with your doctor, follow-ups, outpatient consultations. It does not apply to things like lab work, x-rays, outpatient injections or infusions like chemotherapy or iron infusions or other types of infusions in a doctor's office setting. It also doesn't apply to chiropractic spinal adjustments. These are billed differently under Medicare, and with Plan N, Medicare pays 80% and your plan pays the 20%. There's no extra copay there. So the truth about excess charges, let's get into it. Here's another area where misinformation runs wild. Plan N does not cover Part B excess charges. There are a few states where doctors legally cannot bill them. These are called Medicare Overage Measure states, also known as MOM states. The MOM states are the following: Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. In those states, excess charges are banned. In all other states, doctors technically can bill them, but what I've seen over the years in practice, those excess charges are rarely billed. So here's the big difference most people care about: the premiums. Plan G, usually the higher monthly premium. Plan N, typically $30 to $40 less per month than Plan G in most states across the country. So the trade-off is simple. Pay a little more each month for zero copays and no excess charges, go with Plan G. Or if you want to save $30 to $40 a month with Plan N, but know you may have a $20 copay at a doctor's office and you may risk those rare excess charges, then you go with Plan N. So who should choose Plan G? Plan G is great for people who want predictable costs and no surprises, see multiple doctors or specialists, Live outside the mom states where excess charges could happen. Value the peace of mind of a set it and forget it Medicare plan. And who should choose Plan N? Plan N works great for people who want to save $30 to $40 per month. They don't mind the $20 copays at doctor's visits, or they may not even go to the doctor often. They live in mom states where those Part B excess charges are banned. And as I said earlier, are generally healthy and don't go to the doctor often. So here's the bottom line. Plan G, higher monthly premium, no copays, no excess charges. A Plan N, lower premium, $20 copay when you visit your doctor, or a $50 ER copay when you go to the ER if not admitted to the hospital. Both are excellent options because they do keep you on original traditional Medicare. If you're comparing a Plan G or a Plan N to a Medicare Advantage plan, remember a Medicare Advantage plan, which you can find topics all over the place, and I have a lot of videos on that topic. It does take you off of your original traditional Medicare. So that's a whole different video topic. We are simply today, we have been discussing keeping your original Medicare and being with a Plan G or Plan N and comparing those two. At the end of the day, there is no one size fits all Medicare plan. The right plan depends on your budget, your health, and your peace of mind. If you'd like help comparing rates in your state, that's exactly what we do. We work with clients in all 50 states, and I'd be happy to help. Don't forget to like this video, subscribe to the Medicare Truth, and hit that bell icon so that you don't miss the next update. As always, thanks for watching. And remember, the right Medicare plan is the one that helps you feel secure. That's all for now. And as always, please be well.